We're going to transition into the major goal of this presentation, and that is skeletal muscle identification. There are many muscles that can be found on the body, each with their own very unique name. While skeletal muscle names might seem confusing at times, they actually lend a lot of insight to the particular muscle they're referring to. Before we get started on learning the muscles of the head, neck, back, and chest, we're going to real quickly discuss some of the ways that muscles can be named. This is a very important and useful slide. As we start to go through these muscles, you'll find that their names might sound rather peculiar. However, we can break down the names of our muscles to get a little bit of information about that muscle specifically. There are lots of factors that play into the way that our muscles are named. The size of our muscle, the location of our muscle, and the origin and the insertion of our muscle are all factors that we will use to name our muscles. This can be rather useful if you see a muscle in a particular area or that looks rather unique. Oftentimes, in those instances, the muscle's name will relate to those factors. So we're going to first go over how muscles can be named, and then we'll go into the first muscles that we're going to start to identify. So the first criteria that I want to mention for how muscles can be named is their location. An example of this is the temporalis muscle. The temporalis muscle can be found just superficial to the temporal bone. This is just one example of a muscle that is named based on its location. We will come to see that location is one of the more common ways that muscles can be named. We also see that the size of the muscle is another factor that can contribute to a muscle's name. For example, the gluteus maximus muscle is the largest muscle in the body. That's why we tack on this last term, maximus. We will also come to see that there is a gluteus medius muscle as well, and that's going to be a little smaller than the gluteus maximus. So typically, we'll only use criteria if it's relevant to compare two different muscles. Since we have two gluteal muscles, one is larger than the other, we use size to distinguish those two different muscles. Now, this being said, I do want to focus on this first term a little bit as well. This gluteus muscle indicates that we're in the gluteal region. So we're actually going back to see that location is used for this muscle as well. We are specifying the location of the muscle, and then we're specifying how large that muscle is. Another example that uses two different criteria is the triceps brachii muscle. We use the term brachii to indicate that it's on the brachial region. This is in the upper arm. So location is also a factor that's going to help name this muscle. But we also will see that the number of origins that a muscle have is also a criteria that we can use in order to name it. Tri means three. So the triceps brachii is indicating that this muscle has three different origins. So we now have an example that uses the number of origin and the location, and also the size of the muscle and the location. Muscle fiber direction is also a factor that we will see that is especially important with the muscles that make up the abdominal wall. Specifically, the rectus abdominis is going to be one muscle that's named depending on the direction of the fibers. Rectus is going to mean straight up. So when we are erect, these muscle fibers are vertically arranged. And once again, abdominis will indicate the abdominal region. So hopefully you're seeing how vital the location of the muscle is, especially with naming. Specifically, the location of the origin and the insertion can be used. One fabulous example of this is the sternocleidomastoid muscle. This muscle originates at the sternum and the clavicle, and will eventually go and insert at the mastoid process. The action of a muscle is another factor that we will see very commonly playing a role in how muscles are named. Especially with the forearm, we'll find lots of flexor muscles that will flex the hand, and lots of extensor muscles that will extend the hand. As I mentioned when covering pronation, we have the pronator teres muscle that will allow for the pronation of the forearm. Our last criteria that we want to focus on is the shape. And this is the criteria that we will probably end up using the least. The trapezius is one of our back muscles that's roughly trapezoidal in its shape. Another example of a muscle that's named based on its shape is the deltoid. The deltoid is roughly triangular. So I wanted to just take a little bit of time to go over how muscles can be named so that when we're going over these muscles, you can use this criteria to logically deduce what certain muscles' names are. One last piece of advice that I'll offer you before we start getting into the muscles is that orientation is key. As you're naming muscles, you'll always want to make sure that you are looking at the muscle from the right view. It can be very easy to mix up the front side of the body with the back side of the body, or perhaps the front side of the arm with the back side of the arm. So always make sure that before you start selecting questions on quizzes that you've properly oriented your picture and know exactly what muscles that you're looking at. So we're moving on to the skeletal muscle identification, and we're going to start with the muscles of the head and the neck. We'll then make our way down to the chest and the back. So first and foremost, there are 5 muscles that can be found on the head and 1 muscle that can be found on the neck. Specifically, the one muscle that's found on the neck is the sternocleidomastoid muscle. We saw this just on the previous slide as an example of a muscle that is named based on the location of its origin and its insertion. The temporalis muscle, orbicularis oculi muscle, zygomaticus muscle, orbicularis oris muscle, and masseter muscle are all found on the head. And each of these names will give us some insight about where these muscles are, what they look like, and what their function is. First and foremost, let's discuss the 2 orbicularis muscles. We have the orbicularis oculi muscle that can be found here around the eye, and the orbicularis oris muscle that is found over here around the mouth. We'll have 2 orbicularis oculi muscles. This muscle is called orbicularis because it's circular in its shape and therefore represents an orb. And it's followed up by oculi because that's going to indicate that we're around the eye. Ocular means eye, so therefore the orbicularis oculi is the round muscle that can be found around the eye. We will have 2 of these, as of course we have 2 eyes. The orbicularis oris muscle, on the other hand, is also a circular sphincter muscle. Sphincter muscles close around a central point, and the orbicularis oculi is also a sphincter muscle. The orbicularis oris is named because oral means mouth, and this is the sphincter muscle that wraps around the mouth. So we have the 2 orbicularis oculi muscles around the eyes, and we'll only have 1 orbicularis oris muscle that wraps around the mouth. Between these 2, we'll find the zygomaticus muscle. There is, in fact, a zygomaticus major muscle and a zygomaticus minor muscle if we wanted to get really specific. Zygomaticus major is a bit bigger than zygomaticus minor, hence why we include the terms major and minor. However, you just need to be aware of what is on these PowerPoint slides, and the zygomaticus muscle is found right here. We name the zygomaticus muscle specifically based on its location. And so far, these 3 muscles are all named based on their location in some way. Oculi for around the eye, oris for around the mouth, and zygomaticus, as this is right superficial to the zygomatic bone. The remaining 2 muscles of the head are the temporalis muscle and the masseter muscle. The temporalis muscle, as also discussed earlier, is a good example of a muscle that's named strictly based on its location. This muscle covers up the temporal bone, and while we don't call this the temporal muscle, the temporalis sounds very, very similar. The last muscle of the head that we have is the masseter. Now the masseter is the first muscle that we have seen that is not directly named based on its location. However, the masseter is named based on other criteria, specifically its action. The masseter can be found here deep in the buccal region. The masseter is what's referred to as one of our muscles of mastication. And if you've never heard of that word before, mastication means chewing. So therefore, the masseter facilitates mastication, and that's where we get its name. This is going to be one of our muscles for chewing. The last muscle that we see here above the shoulders is the sternocleidomastoid. The sternocleidomastoid is named because of its 2 major attachment points down here at the sternum in the clavicle and up here at the mastoid process. You'll see the sternocleidomastoid in this view, and you can also come back to this view and see the sternocleidomastoid muscle here as well. We'll find the temporalis muscle, the orbicularis oculi, the zygomaticus, and the orbicularis oris. Here, deep in the buccal region, you'll find your masseter muscle. So it's very important that we can go from picture to picture and identify these muscles in different views. You will have various pictures on the midterm exam, and you'll want to make sure that you can identify these muscles on other diagrams and not just on this picture specifically. So to review the muscles of the head and the neck, the temporalis muscle can be found in the temporal region. The 2 orbicularis oculi muscles can be found wrapping around the eyes. These are circular sphincter muscles, hence their name orbicularis, and they're also found around the eye, which is where we get the oculi portion. The orbicularis oris is quite similar, as it's also a circular muscle, however this wraps around the mouth. The zygomaticus muscle will be sitting right above the zygomatic bone. So this is our fourth muscle that's named based on its location. The masseter is our one muscle up here that's specifically named based on its action, which is mastication. This will be one of our muscles of chewing. And lastly, the sternocleidomastoid attaches to the sternum, the clavicle, and the mastoid process. This is one of the muscles that you can see with the naked eye and feel on yourself. The next set of muscles that we're going to discuss are the muscles of the chest, and then after we've discussed these three, we'll make our way to the muscles of the back. So anteriorly are the three muscles of the chest, and posteriorly are the muscles of the back. The three muscles of the chest include the pectoralis major, the pectoralis minor, and the serratus anterior. Let's go ahead and break down these names to get a little bit of information about these muscles before we see them. The pectoralis major muscle is named based on two sets of criteria: location and size. Pectoralis major is found on the pectoral region, that's the chest, and it's called major because it's the bigger of the two. Pectoralis minor is also found on the pectoral region, but it's simply going to be much smaller. That leaves us with the serratus anterior muscle that will be found inserting on each of our ribs. This arrangement of the insertions of this muscle make this muscle in particular look rather serrated, and it also courses around the anterior side of our chest, hence where we get the name serratus anterior. Let's take a look at these three muscles. Here we have our pectoralis major muscle. This is the larger of the two pectoral muscles, and you can see that here. This is going to be the dividing line between the pectoralis major and what's known as the deltoid. We'll discuss this muscle shortly. So pectoralis major is the more superficial of our two pectoral muscles. If we move over here, we've seen that the pectoralis major has now been removed, and under the pectoralis major, we will find pectoralis minor. This is going to have different insertions that will go to three of our ribs, but this is a much smaller muscle, hence why we call it pectoralis minor. Don't get pectoralis minor mixed up with the serratus anterior. Serratus anterior will insert at each of the ribs as they go down the thoracic cage. It is this arrangement that makes this muscle look rather serrated. We can see from this picture that pectoralis major is our most superficial. Pectoralis minor will be intermediate, the pectoralis major and the serratus anterior, and the serratus anterior will be the deepest of these three chest muscles. As we rotate and view the posterior side, we'll see the muscles of the back. Specifically, there's 4 larger muscles and 4 rotator cuff muscles that will be found specifically around the scapula. The larger muscles are the latissimus dorsi, levator scapulae, the deltoid, and the trapezius. As already discussed, the trapezius and the deltoid muscles are named based on their shape. The trapezius is roughly trapezoidal in its figure, and the deltoid is shaped roughly like a triangle. However, the levator scapulae and latissimus dorsi are 2 muscles that we have not yet seen. We will look at these 2 muscles very shortly. But we will also see that we have 4 rotator cuff muscles, namely the supraspinatus muscle, infraspinatus muscle, subscapularis muscle, and the teres minor muscle. There's quite a few more muscles on the back compared to the chest. Specifically, we can see the trapezius muscle shown here. This is the one that's roughly trapezoidal in its shape. The trapezius muscle specifically is one of the muscles of the back that feel really good to get massaged. It is this muscle that is one of the more superior muscles of the back. Here over to the shoulder we'll find the deltoid, and I'll actually take a second to go back to this picture to remind you that the deltoid is actually seen from the anterior view as well. So we want to be able to make sure that we can identify these muscles from either view. The latissimus dorsi muscle is named because it's on the dorsal side of the body. Oftentimes the latissimus dorsi is referred to our wings, as when these muscles are very developed, they will stick out and show when the arms are abducted. Aside from the rotator cuff, the levator scapulae is our other muscle here that can be found on the back. This muscle is found deep to the trapezius, and we won't see it unless the trapezius has been removed. But the name of this muscle gives us a lot of insight about the action of this muscle. Remember, muscles will only shorten in their length. So the origin found up here on the cervical vertebrae, and the insertion down here on the scapula will indicate that when this muscle shortens in its length, we're going to elevate the scapula. So the levator scapulae and the trapezius muscle will help us to do the action of shrugging. Just a side note, with 3 other muscles that can be found on the back are the rhomboid major muscle, the rhomboid minor muscle, and the teres major muscle. The rhomboid muscles will help us to row and bring our scapula more medially on the back. And the teres minor muscle is going to be very closely associated with the four muscles of our rotator cuff. We will go over the rotator cuff next. Specifically, there are four rotator cuff muscles. The supraspinatus, infraspinatus, and teres minor are the three rotator cuff muscles that can be viewed from the posterior side. There is one more, the subscapularis. However, this muscle is found on the other side of the scapula, and it sits specifically in the subscapular fossa. I will show you that one shortly. With the rotator cuff, we want to remember the bone markings of the scapula. The posterior side of the scapula contains what's known as the spine of the scapula. This is a bone marking that we should be relatively familiar with. Above the spine of the scapula was the supraspinous fossa, and below the spine of the scapula was the infraspinous fossa. So the names of these two muscles will indicate that they will sit in each of these respective fossa. The supraspinatus muscle sits in the supraspinous fossa, and the infraspinatus muscle will sit in the infraspinous fossa just below the spine of the scapula. Teres minor will be the smallest of our rotator cuff muscles, and this will insert at the same location that the infraspinatus will. Therefore, these two muscles will tend to do very similar type actions. Our last rotator cuff muscle is the subscapularis. The subscapularis is unique because it's found on the anterior side of the scapula, specifically in the subscapular fossa, hence its name as the subscapularis muscle. One way that we can see that this is the anterior side of the scapula is that there's no scapular spine on this side. We'll also find the clavicle shown here, and the clavicle is an anterior structure. So it's bone markings and muscles like these that we want to be careful about when we are trying to distinguish what side of the body we are looking at. It might seem rather simple to identify something as the clavicle when looking at these muscular questions. However, I have seen it too many times, so I just want to make sure that we remember that orientation is key with the muscular system. So to summarize the muscles of the back, we have the trapezius, which is going to be our most superficial. This is roughly shaped like a trapezoid, hence its name. On the shoulder, we'll find the deltoid, and this muscle will help us for the action of abduction. The latissimus dorsi will sit on the medial portion of the back, and the levator scapulae will attach to the superior part of the scapula, and that will help to raise the scapula, hence its name. Both the levator scapulae and the trapezius muscles will both help to shrug. The four rotator cuff muscles can be found around the scapula specifically. The supraspinatus muscle sits in the supraspinous fossa, and the infraspinatus muscle will sit in the infraspinous fossa. The subscapularis muscle will sit in the subscapular fossa, and the teres minor is very closely associated with the infraspinatus. We'll come to see that these four muscles are fixators or stabilizers, and they will help for the medial and lateral rotation of the humerus. We also don't want to forget teres major, rhomboid major, and rhomboid minor. This concludes the muscles of the chest and the back.